incident in relation to Holy Spirit Home in Carseldine. Secondly, as part of that, the overall aged care rollout and the broader national rollout, where we have some very positive figures today, I'd be pleased to say. Thirdly, to deal with the news out of New Zealand and the Commonwealth hotspot declaration made by the Chief Medical Officer, and fourthly, the Aged Care Royal Commission and related to that private health insurance. If I may, in relation to the Holy Spirit Home in Carseldine, just before joining you, Michael and I spoke with Dr. Liz Rushbrook, who is the Chief Medical Officer of Metro North in Queensland. She's overseeing the care of the two patients, the 88-year-old male and the 94-year-old female, who were given more than the recommended dose. Her advice to us was very good and very heartening. Both patients are well. Neither is suffering any adverse effects. The woman will return home to her residential home in the facility after she's had lunch today. That was the request of the family. The man will stay in hospital for no other reason other than that he was actually admitted in preparation for elective surgery and an appropriate procedure unrelated to this. So the fact that the surgery is proceeding, the fact that the woman in question is returning home is, I think, a very positive sign. That is the first and foremost element. Secondly, of course, Michael has now completed his investigation, and I will allow him to go through his findings. But in particular, the bottom line here is that the doctor in question administered a dose in breach of the recommended and prescribed amounts, I believe to be approximately 4 times the recommended dose. But as Michael will explain, that this is similar to those amounts which were administered during the clinical trials and has also occurred in other places. But it was an unacceptable action. As we now know, contrary to the advice given in writing as well as verbally by the company yesterday, the doctor wasn't trained, and so as a consequence of that, there will be a medical referral in relation to the doctor. The company has had the book thrown at it by Professor Brendan Murphy as secretary, not something he does very often, and a series of actions are occurring. Firstly, they have been put on notice of potential termination for any significant further breaches. Secondly, they have brought in their chair to act in an executive administration role. Thirdly, they brought in additional senior management. Fourth, at the Commonwealth's request, the Commonwealth has installed the clinical leadership of the former Chief Nursing and Midwifery Officer of Australia, Deb Toms, and we will be standing up additional support in New South Wales and Queensland for aged care. We will be bringing on an additional provider. This particular provider, Healthcare Australia, operates under contract in those 2 states. So that then brings me to the broader rollout. At this stage, as of last evening, the advice I have is that 71 aged care facilities had been completed and 4,715 aged care residents had been vaccinated. Today, we're expecting over 20 additional facilities. We always check at the end of the day to be done, and in particular, they're dealing with some of the more complex facilities, and well over 1,600 additional patients to be vaccinated. Importantly, the advice from Liz was that yesterday 60 patients were vaccinated at Holy Spirit Carseldine, and today the program is continuing, and they were expecting over 95% take-up. Of course, individuals who may be in the later stages of their lives or have an illness may not be vaccinated under those circumstances, but that the take-up in that facility is extraordinary and heartening, and we are seeing very high take-up rates around the country in our facilities. In addition, the advice that I have is that as of yesterday evening, the national vaccination program, in cooperation with the states, had completed over 17,500 vaccinations. The ramp up over the course of the first 3 days has been approximately 1,600, then 6,000, then almost 10,000. And so what we're seeing is exactly as planned. From a small base, continuous growth. We've always said that there would be challenges and there would be issues. The one that occurred this week was earlier and certainly more concerning than that which was anticipated. And, I have apologised for that, and we apologise for that again. But it is very important to see that this program is actually rolling out right around the country. I will make one point here that in 6 of the 8 states and territories, the provider Aspen is meeting all of their deadlines and contracts. There have been some reports out of New South Wales and Queensland which are accurate, where facilities which had expected to be vaccinated today have not been, and that is because the provider in question, Healthcare Australia, slowed down their rollout in response to a demand from the department that they provide an absolute guarantee of clinical certainty and quality. They were reviewing their practices this morning. I would note that the particular agency has been engaged in New South Wales for hotel quarantine, in Victoria for hotel quarantine, in Western Australia for hotel quarantine, in the Northern Territory for hotel quarantine, and in other COVID emergency response roles in Western Australia, New South Wales and Victoria. Having said that, Brendan threw the book at them. They are on notice of termination. But around the country, the program is proceeding, and we're delighted at those figures, which will continue to grow.